Okay, so I would now like to introduce our panel members. We have Hannah Gift, who's an OT and a CHT from St. Louis, Missouri. Laura Johnson from Marlton, New Jersey, who is a DPT and CHT. And Chavi Perlman, who's an OT and CHT from Silver Springs, Maryland. All three of them are CHTs, obviously, and they all took the test not real recently, a couple years ago. So they're going to share with you their study techniques and give you some hints about, how you might go about establishing your study plan. So, Anna, I want to leave it to you.
Yeah, hi. So I went to OT school thinking that hand therapy was the most boring way to have an OT profession, and I left OT school thinking I wanted to be a hand therapist, no questions. So took a couple anatomy classes and I was hooked. And so during my field work, someone mentioned a hand therapy fellowship, and I had never heard of it. I started looking into it, and 6 months into being an OT, I started the Philadelphia Hand Center Fellowship. And part of the fellowship required readings, weekly orthosis fabrication labs, weekly lectures with senior faculty, monthly surgical observations, monthly office hour observations, and then a full clinical caseload. So it was a pretty intense 6 months, but it started me off with my basics. I left my fellowship and I got a hand therapy job, and I had all of these books and journal articles and all of these resources from continuing ed courses, and I thought, I don't know how I'm ever going to organize this. So I started my CHT review book. And what it was is a Microsoft Word document, and every diagnosis had a different page. And so it started with the diagnosis, the involved anatomy, the special testing involved, what rehab might look like from a progression wise. So whether it was from a bone healing perspective or a tendon healing perspective, what the progression might look like, and then some hallmark articles to go back through. And so that's how I started the process of organizing all of my information that I had gained. And then that book is what I took to future courses. So instead of just taking notes in the course manual, I was taking it through that book. So I had everything organized. So I would recommend figuring out for you what that looks like, and whether it's a Google Doc or whether it's a handwritten notes, but somehow organizing everything that you started with, because it's going to all start getting jumbled somewhere in there. And when I took it, you had to be 5 years out of school. So I started out just taking every continuing ed course I could find. And I thought of it more of as an investment, because sometimes they do look expensive and you think, I can't take too many $35 webinars anymore, but at some point it is an investment that in the future will absolutely pay off. So I started with taking every continuing ed course I could find. And about 2 years before I took the course is when I really started to buckle down into the nitty-gritty studying. So it wasn't just becoming a better therapist, it was actually the nitty-gritty stuff. And I started dedicating 5 to 10 hours a week, and I would go through, and about every month I would have a different topic. And so nerves, for example, I would find rehab of the hand and read the chapters on the nerve section. And then I would go through my note cards that were about nerves. And what I did was I had a whiteboard, and I would just write down everything that was on the note card, because I find writing to be very helpful from a memory perspective. So I would use a whiteboard to write things down, and then after I reviewed all the information, I would go to the purple book and then answer questions about that topic. So I was someone that I would pick a topic as opposed to a resource, and I would just take everything I had from that topic moving forward. And so those were my study tips getting into the exam. I also took every opportunity to try to teach others, because I think from a learning perspective, if you can teach the information, you know the information. So I volunteered to give seminars for my hand therapy program. I volunteered to teach there's 3 OT schools in my area. So I volunteered to teach different anatomy courses or kinesiology or modalities. And then I also went through and started writing my own questions. So instead of just taking CHT exam questions, I started writing my own questions, because there's a thought process about answering a question, but there's also a thought process about why is this answer correct and why are these answers wrong. And so that was my way of, once I got to the purple book once or twice and I felt like I'd answered other test questions multiple times, I thought, what if I started writing my own questions? And I've since shared this with other people, but that's one other strategy that I took from a studying perspective. And the last thing that I did that might be a little unique is a couple years ago, jumped in with volunteering with ASHT. So I started on the education division, and my job started with coordinating the hands-on orthotics courses. So I helped to create the manuals for all the hands-on orthotics courses. I taught a few courses, even taught a few orthoses I'd never made before. So that really forced me out of my bubble and forced me to learn things I hadn't learned before. And through that, I've actually moved forward and done other things through ASHT and taught at the annual meeting and other things like that. But that's another unique opportunity to not only network, but also get a chance to demonstrate what you've learned and study for the CHT exam, as well as the other benefits of volunteering that you get. So my kind of take-home message from a study tip would be, I really think flashcards are good, but also writing down the information. So the whiteboard idea might be a good way to save the environment, but to be able to do your flashcards, but writing is really beneficial. To teach other people, because teaching is the highest level of understanding, and just make sure to really dedicate time for where your best practices are. So if you're not a study group person, don't use that time that way. Find your best way to do it and make the most of the time that you have.
Great. What suggestion would you give for people once they're actually in the test center taking the exam? Because a lot of people have test anxiety, and is there any tips that you would have for those people?
Yeah, absolutely. So I would maybe try practicing, it doesn't have to be super formal, but a 1 to 2 minute deep breathing meditation type thing. So sit down, they make you take your smartwatch off, they make you put all your stuff away, and just close your eyes and take 5-10 deep breaths and really get yourself in that space. And I would also recommend from a test taking, when you read the question, don't look at the answers right away. Try to answer the question before you look at the answers, because that will be your gut instinct. So if the answer on the options is something that you came up with, that's going to be the right answer. And so that would be another tip, is to not let the answers distract you, to read the question, let the answer come to your head, and then look at the answers. And then, make sure you use that scratch sheet of paper pretty wisely. And I actually practice the scratch sheet of paper, I hate to say hundreds of times because that would embarrass myself, but it might have been 50 times at least. But I was getting my efficiency, but I was also making sure I knew when I used it where everything was. I knew where the plexus was. I knew where the things I needed. I knew exactly where they were on the page. So when I got it, took a few deep breaths, went through my perfected scratch sheet of paper, and then went forward from there.
Kind of like the data dump, right? You got it all out of your head onto that paper.
Yeah, exactly.
Very funny. Did you only use I understand that they can give you more than one sheet of paper, but I think what candidates, and I mentioned this in my presentation, they need to know is that if you ask for a second piece of paper, they'll take that first one away. So I think that's a good idea to really organize it into, the way you did it, just to make sure you've used every inch of space and not have to do another one and do it all over again. So great. Thanks, Hannah. Thanks. Laura?
Hi. So I came at this kind of from a bit of a different perspective. So I was actually already a practicing PT well before I decided I wanted to be a hand therapist, let alone a CHT. I always knew I wanted to specialize in something, but like Hannah said, I went into school thinking and kind of came out of school thinking that like hand therapy was definitely not in my wheelhouse, that it was going to be boring and I had no desire to do it. But my entire career, including in school, everyone kept telling me that I'd be really good at it. And I just didn't believe them until eventually I just kind of jumped in and went for it. So I actually didn't have any mentorship in my clinic at all. I didn't work in a hand clinic ever. I was the hand clinic. So when I really decided that I wanted to be a CHT, I chose to do the hand and upper extremity certificate program with Jane Fedorsik. At the time, it was at Drexel. It's now at Jefferson. So you can find it, it's there. And I did that a year before I was able to sit for my exam. So like Hannah, I took it when it was a 5-year requirement out of school. So a year before that, I'd been practicing for like 4.5 years. I jumped into the hand program and really used that as my study guide and my timeline to get to the exam. So that whole program is set up really well to really go through all of rehab of the hand. So the entire course, you're reading sections of it, and by the time you're done, you've read the entire thing. And you've been tested on it, and you've taught it, and you've learned it, and you know it, if you put the time in. So that's really how I did the year up into studying, or for my studying, the year before the exam. It had tissue healing, it had current concepts, it reviewed anatomy, both neuro and musculoskeletal. So it was a really great review course for things that I'd learned in school and probably forgot, and a really great teaching course to teach me what I needed to know about hand therapy, both for the CHT and just for clinical practice. So that ended 2 months before I took my exam. I took my exam in November. And between when that course ended and when the exam was, I used the Purple Book the most. I probably spent about 5 to 10 hours a week studying, because I was still a full-time clinician. And I had just kind of loaded up doing the coursework for a year. So I didn't feel like I needed to really spend so much time studying, but more so reviewing. So I went through the Purple Book and answered questions. I tagged things with Post-it notes that I wanted to review again. I also find writing things really, really helpful. So instead of doing flashcards or something like that, I use just like a notebook, and I just write things down in the notebook so that it's written. I can flip the page, I can go through, because it's kind of mirroring what's going on in the Purple Book with what's in my notebook. So I could write things down and then flip back and forth if I needed to. I really focused on reviewing anatomy, which I felt was really helpful for the exam. In my perspective, I feel like most of being a CHT is really understanding your anatomy and tissue healing. So reviewing your functional anatomy, I felt was super important and really did help me in the exam. And then I used my scrap paper at the exam almost exclusively for the cervical plexus and for drawing out all the innervations to every distribution there was. So I found those drawings on YouTube and used them as tutorials. I probably did draw it hundreds of times until it was literally cemented in my brain, and I couldn't possibly have forgotten it for the day of the exam. And I'm glad that I did that, because I felt it was really helpful on exam day. But not, like I said, not just the plexus, but also the peripheral nerves and innervations, because that was one less thing for me to have to worry about forgetting on exam day. Is if I could draw it out and see the picture, then I could really use it and be timely when answering questions. So about a month prior, about a month prior, I reviewed all the tagged things that I had in the Purple Book, that I really felt needed some repeats. And I would go back into my notes from the coursework and back into rehab of the hand to really hone in on finding the answers and understanding why the answers were the way that they needed to be. Once again, still drawing and memorizing the plexus and the peripheral nerves and innervations. About a week prior, I focused on my trouble spots, which for me, I don't know if you've realized, but neuro is not my strongest suit. So I've just spent a lot of time on that, and healing times. And then about a day prior, I just took a break from everything that I'd been doing. I made sure to I actually went out with friends and just kind of forgot that I was taking the exam the next day, because you just really need to be relaxed and not stressing that day before, to give yourself time for your body to kind of settle down and settle in. I'm a clear your head type person, so that works for me. I know some people can't do that, but for me that works. And the day of, I literally woke up, I had flashcards of those last few things that I was really reviewing the week before that I really needed to hone into my brain that I just couldn't get there. So I was reviewing those in the morning and drawing the plexus and the innervations again and again and again, until I jumped in my car to drive to the exam site. When I got there, I did kind of the same thing where I just kind of stopped everything and just was breathing, not reviewing things once you get there, just kind of settle in. You don't need anything with you other than what they give you. And then as soon as I got my paper, I brain dumped the plexus and innervations, and I'm sure one or two other things that I felt I really needed to put down to make sure that they were right there for me to look at, and went from there.
Great. Yeah, I think that's a good suggestion, kind of knowing what you don't know, right? And then really focusing on that. Things that you don't really see in your clinic. Like I saw trauma, but we never did shoulders, so I knew that I really had a bone up on that. So good, thanks. Javi?
Sorry, unmuting myself. So you're driving in?
Yeah, can you start again? You kind of froze there.
So unlike Laura and Hannah, I wanted to go into hand therapy from the beginning. But once I graduated, breaking into the field was difficult. So I literally TCC website and I just cold called all the CHCs in the area until somebody would hire a new grad. And I got a job just Mondays and Fridays. And eventually I got a full-time position, but if breaking into the field is hard, just keep trying, eventually get there at some point. So when I first was working, you had to be working for 5 years before taking the exam. And then during that period, it switched to 3 years. And I was right at the 3-year point when that happened. So the pressure was on. So right away I'll take it. I also applied for the Mary Cash Scholarship through HECC, and I eventually got it, cover the expenses financially. So first I gathered the study materials. So as mentioned before, I got the ASHT book, and it began kind of like combining those two. The ASHT book is kind of dry and it's kind of like lines. So that combined with the purple book that's more interesting and questions, I found to be a good combination of kind of going back and forth between the topics. Just like Hannah mentioned with the Google Doc, I did the same thing. I think us OTs are all very tap learners where we need to have something typing or writing or something really, hone in to really register it. So the whole time I had a Google Doc running of top that I had to go back to, I knew how to review. And that I found helpful. And any spare moment I had, I pulled out that Google Doc and just like reviewed it and really kind of into brain. I was also at the time working full time with 2 young girls with an hour plus commute. So I really had to find strategies to fit studying into that schedule. So I utilized occupationaltherapy.com. They can, just do an audio file. My commute's always listening to some sort of lecture. Whenever I had a few moment, like in the grocery store or just waiting at a doctor's appointment, I always had something handy also. I deleted all the meaningless social media apps. So I didn't have a chance for my mind to wander to those things. Was focused on studying all the time. As mentioned earlier, also like think about the study strategies that work for you. Some people do well in a group. I never did well in a group, so I specifically did not go that route. I worked well with the pressure of a test date. If I knew I had a date and a deadline, I worked well with the procrastination aspect. And again, the like just tactile component, writing as I'm reading, and I'm reading I also took tests throughout. I took a test in the beginning, a practice test, and then I maybe like 2 more throughout, and then I really reviewed every single question I got wrong. And I think that actually helped me the day of, that it wasn't as like foreign and overwhelming. I was just like, it's just another practice test. And then, yeah, so I think it's just a matter of setting a time. It's never a good time. So you just set a date and kind of take the baby steps to get there. And I think, of course, it's frustrating if you pass on the film, but look at it as a rewarding process. It really helped me connect all between like everything that I was already doing, but didn't necessarily understand the connection between everything. It really helped, I think, bring me to the next level of thinking. So you pass, you don't pass. It's really when, in my opinion. And that's it.
Okay, great. Yeah, I think that's a good point. I mean, it's like, even if you don't pass, you become a better therapist just by the process, right? So I'm going to have each of you respond to this, and probably it's going to be a very similar answer, but what would be your one best piece of advice to give somebody who's studying for this exam? So Laura, you go first.
I probably honed in on it when I was talking, but mine is to really know and review and write down, draw out the nerves. So plexus all the way down.
Okay, good. Hannah?
Mine would be to find an opportunity to teach others, because I really think that's the highest level of understanding, is when you can teach it to others. And my other one would be, don't study the day before. Go out to brunch, hang out with your friends, take some deep breaths, hang out. The hay is in the barn, or whatever that corny phrase is. But you really, once you get to that day before, you need that time to relax. So be confident and go in knowing that you know it and that you have done this for up to 3 years, potentially, maybe even more. So just be confident.
Yeah, in terms of teaching, somebody once mentioned that they just taught their patients everything. Every patient that came in with a diagnosis, they just, taught them everything there is to know about their diagnosis and what they were doing. And I thought that was a really great piece of advice.
I think it's a great piece of advice. And I think if you don't find an opportunity to teach, there is every OT school across the board looking to find a fieldwork student. And PT schools are looking for people that take students as well.
Mm-hmm.
So there is opportunities, and there are people that would love to listen to you just ramble about the most minute details to help you understand.
Great. Xavi, I just love the fact that you went to our directory and called everybody in your area looking for a job, because
Literally.
Because we get, when we go to AOTA, the students come up, or even new therapists, they always say, how do I break into the field? You have to have experience to get into the field. And, one of our recommendations is like join a local organization, join ASHT, network, get your name out there, show people you're interested in. And we've even made that recommendation, but I didn't know anybody who's actually done it.
I literally did it. I even had interviews where I showed up and I was like, why were you on the HCC website? They're like, this is an inpatient physician. Like, why were you listed? Because it was just like, it was listed on, I just called every single possible opportunity that, yeah.
And I think
it ended up working out.
If I have time too, even if they're not hiring, you can say, can I come every, one afternoon a week and just observe, or, whatever it is, just to get that experience. So Xavi, what would be your one best piece of advice?
My piece of advice would be, don't just think of studying as an hour set aside at night. It would be, think of every single free moment throughout your day as an opportunity to study. And it's way less overwhelming like that. It's just, you can get so much into your day. You don't realize how much idle time there is if you eliminate all those idle distractions.
Great. Yeah, I think that's a great piece of advice. Do you guys have any feedback for HTCC that you'd like to share? Like things that we could do to make the process easier, or, whatever.
If anything, I think something that I liked about the exam was that you had this opportunity that if you thought that one of the questions, there were 2 correct answers, or if there wasn't a correct answer, that there was an opportunity to write in, you know, your thought process of why both of these seem like they would be right. And I think having that option there also was comforting to me, that someone was like listening to feedback as we were taking it.
Yeah, I know it's really frustrating that people don't get the results right away, but it's because of that process that it takes so long. Because we literally look at every single comment that's made. And exam committee, you know, not all the time, but, you know, quite frequently we'll have to double key some items on the exam because, you know, those items have gone through so many people, and sometimes we're just amazed that we didn't catch an error, you know. So I think it's really to our candidates' benefit that we have that option. So yeah, that's good. Thanks.
I would also say that both for those that are studying right now as like an encouragement, and for you guys, like the exam is fair. They're like, it's not looking to try to stump you and, you know, and trip you up. It's really trying to make sure that you're the best therapist that you can be and make sure you really know your stuff. So don't read the questions like they're trying to like trick you into something. They're not. They're just really wanting to know, like, does your brain really understand this concept?
Mm-hmm.
So I thought it was a really fair exam.
That's good to hear.
Yeah, I agree.
I agree with that. And I agree that I like the option to write in a comment. I didn't end up writing any, but it's nice to have that option. And obviously it's really nice to tag a question that you want to go back to. That saves a world of time. And it's probably not new or revolutionary, but that was pretty fantastic. What I think HTCC does a great job of being very clear about everything, but I would say not everybody reads all of the directions, instructions, that kind of thing. So a lot of the questions I get, you know, if you go back to the website and look, just look through it closely before you start signing up for the exam, because all of the answers are in there. You just have to look closely. But the other questions I get are usually like, well, what did you put on your scrap paper? Well, you've been studying this whole time. What do you need to put on the scrap paper, right? Because you're not what I need to put on my scrap paper. Because people ask me all the time, can I see what yours was? And this is 3 years ago. I don't have any copies, hopefully, laying around here. But, you know, what do you need out of it? So just keep in mind that it's not what other people have done or what their best cases are, but like look at how you learn best, what you need to focus on, and what's best for you, and make that your focus.
Well, I thank all three of you. I say four because I see my other square up there. And people watching this video, if we haven't addressed any of your questions, feel free to email us at info@htc.org. Give us a call. We are really good about responding that same day. So any question, big or small, just give us a call. Thanks so much, you guys.
Thanks.
Thanks.
Have a good night, guys.
You too.
Bye, guys.